Hello everybody and welcome to another question of the day. Today's question has to do with body mass index, and the question is, why does everyone talk about body mass index and why is that so important? So in general health and fitness, as well as in the medical field, we use body mass index as a guideline to tell us how healthy or unhealthy a person is. There are some caveats to body mass index that I will tell you, but in general, we look at the height to weight ratio and it gives you a number. Patients who are less than 18.5 body mass index are considered underweight. Patients who are 18.5 to 25 are considered normal weight. Patients who are 25 to 30 are considered overweight. And patients who are greater than 30 are considered obese. Why is body mass index not perfect? Well, an example would be me. I'm 5'8" and I weigh 180 pounds. My BMI is 27. That puts me into the overweight category, and I can promise you I am not overweight. So why is that? Well, body mass index doesn't take into account your lean mass or your muscle mass compared to your fat mass. So I, at my height and weight, carry a lot more muscle mass than I do fat mass, which makes my body mass index high, yet I'm healthy. So we have to take that with a grain of salt when we see you in the office to talk about body mass index. Now, why is that important? It's important for a couple reasons when we talk about surgery. The first reason is we know that patients with a BMI above 30 who have surgery have much higher complication rates of things like wound healing problems, pulmonary complications, blood clots, many other things that are negative to having surgery when your BMI is too high. The second reason that BMI is so important surgically is because when we're doing something like a tummy tuck and a patient's BMI is really high, you're kind of chasing your tail at giving them a good result. One of the issues when we do a tummy tuck is patients want to have as flat of a stomach as possible. When you harbor visceral fat, which is the fat that's underneath the rectus abdominis muscles, which surrounds the organs, I don't operate in that zone. In my general surgery days when I was in the belly, I was doing a lot of that stuff. But in plastic surgery, we're not operating inside of the abdomen, so I can't do anything for your visceral fat. What I do when I do a tummy tuck is I tighten up the rectus diastasis, or the separation of the muscles, which does help to flatten your abdomen. But if you're harboring a ton of visceral fat inside of your belly that's pushing out on the muscles, then I'm really chasing my tail at trying to make you as flat as possible. So this is why patients, when I see you in the office and your body mass index is a little too high and you're not one of those people that has more muscle mass, you have more fat mass, we're asking you to lose weight for several reasons. We're not body shaming you. We're not telling you that you don't look good. What we're telling you is you have extra fat. In order for me to get the best result possible and make your abdomen flat, you need to lose weight so that you burn visceral fat such that when I plicate your abdominal muscles, I can make you as flat as possible and give you the result that you came for. The other reason it's important is we're trying to minimize your complications for surgery. So that's why body mass index is a really important guideline. Good surgeons and good doctors take into account whether you have more fat mass versus muscle mass, and we make decisions based on that. So the whole concept of my wellness center, what I'm trying to create is we're going to help you lose weight. We're starting this process up soon. We've been doing a lot behind the scenes. We're going to help you get to where you want to be. And I can promise you that if you engage in the process and you work with us to help you get to where you need to be with your weight, we are going to give you the most unbelievably lifelong lasting result that you could ever imagine. It's going to go way beyond just having you get a good result in surgery. We're going to equip you with what you need to live a healthy lifestyle before surgery so that after surgery, you will maintain a slamming result and live the rest of your life healthy and never need another tummy tuck or other body procedure again. So that's why body mass index is important. I hope that it helps answer your question. Again, you guys ask the question and I will answer it. Have a great day.